everyone. I'm Natalie Kunzman, MD, and I've had a few questions in the past few weeks about what is the best dietary strategy to help with somebody who already is inflamed or has an autoimmune condition. This sometimes has to be catered per patient, obviously, based upon some food tolerances, likes, dislikes, but also some of the frank allergenic nature of certain foods per person. And that goes without saying. If you have a gluten intolerance or have celiac disease, you obviously can't have wheat and gluten products. If you have a peanut allergy, you may need to stay away from peanuts and legumes. So that's not exactly the true topic of today's discussion. Let's make sure that is just foundational and an understanding that we have that anybody with allergies needs to avoid those foods. Okay, so when the body is on fire, per se, with an autoimmune condition, autoimmune means that whether cellular mimicry or food issues or gut issues or honestly poor dietary intake is creating the phenomenon of leaky gut and allowing toxins to come through the bloodstream, promoting some of the inflammatory cascade of cytokines and immunoglobulins and factors that may actually be destroying some tissue. This is what we need to avoid. And I firmly believe that a lot of people can gain a marked percentage of control of their autoimmunity. And of course, mild conditions may respond primarily to the dietary approach. Severe cases, when the cat's out of the bag, and some of disease modulation and medications are needed, or a lot of aggressive energetic work needs to help heal the tissue. The diet will contribute to those protocols, but it may not be 100% of the fixer upper. Okay, so here we go. A quick and dirty recommendation would be the autoimmune paleo dieting strategy. And the reason I'm going to use this as the prototype is it is prototypical in its approach. So I will use this as a prototype, but embed some of the other strategies in the meantime. Okay, so paleo implies that we are eating for our ancestral genetic and gut bacteria makeup. We are still having that bacterial microbiome that we've had many, many years ago, long before our industrial agricultural farming that has only been in the past 100 or 200 years. So the bottom line is our gut microbiome isn't evolving fast enough for the changes in some of the genetically modified foods that we are ingesting, let alone the pesticides and the soil depletions that are coming from the industrialized farming. Okay? And in that approach, of course, we are looking for more organic and heirloom variety of our vegetation. So vegetables are very, very high and welcomed in the autoimmune paleo diet. However, the meats are fine so long as they are well sourced, they are grass fed, they also have had organic and humane living conditions, because whatever grains and poor feeding and slop food that the animals may be getting is what is manufactured in their organs and their meaty tissue which we eat. So paleo does allow good meats that are well sourced and lots of vegetation. But the immune protocol in paleo dieting and paleo in general also is non-grain. Okay, so if you are non-grain, you are cutting out a lot of the excessive carbohydrate based food ingestion that is high calorie but low nutrient. Okay, so you can't get too many vitamins from a piece of bread. And a lot of the grains that we have rendered down have a lot of inflammatory chemicals on their surroundings that are really harmful to the gut. Gluten happens to be one of them. Very harmful to the gut, particularly in excess. Also in the immune protocol for autoimmunity are some of those inflammatory foods that may not necessarily make sense for you. So nuts are for the most part eliminated in the autoimmune paleo, and that is because nuts and seeds have a lot of protective lectins and chemicals that protect it from being weathered down or eaten, and that is also very inflammatory on the gut system. So once the gut is healed, those can be reintroduced down the road. Also in the AIP diet, we eliminate the Nightshade family, and that would be your potato, tomato, eggplant, acai berries, peppers, tobacco, which just happens to be in that category as well. And that's because of the acetylcholinesterase issues and chemistry that is within those vegetables, which seems to be very hard on an autoimmune patient and the inflammatory gut system. Now, a lot of spin-offs for low inflammatory diets are really boiling down to the same principles. High vegetation that is organic, pesticide-free. We enjoy a varied nature and variable colors of the vegetation because that's what our gut systems need for the wonderful fiber, the wonderful nutrient content, and of course that's what our guts are designed to help break down, continue the gut motility. And our detox mechanisms know how to manage these substances. Meats are on the lower side. Now notice I didn't talk about keto and oils. Okay. The oils that we use in a low inflammatory diet are pretty specific, and they are those that are, if you think about it, in our old lives as farmers. Things such as lard and tallow, ghee, which is rendered down butter, and these oils don't break down with higher heating, and they don't become rancid in the body, and they release very little linoleic acid. Now, once you start getting into the corn oils and safflower and combo Crisco and vegetable oils, these will have a tendency to become rancid with the heating process, and it backfires in our system and becomes pro-inflammatory. It can promote fatty liver infiltration, and to that note can trickle down and lead to insulin resistance and the diabetic phenomenon. So the oils must be very, very organic and not cut with some of the other safflower and industrialized oils. So even where olive oil is concerned, you would want to consider your Greek and Italian oils that are pressed, that are not getting processed in rendering plants and adding more oils to it. Okay, so this is the autoimmune paleo diet as the prototype. There are many people that will do a Mediterranean style, and of course that is extremely low carbohydrate. And again, where carbohydrates come in is they will produce, especially in a high carb diet, they will produce our bodies to make a lot of insulin to try to manage this. Insulin is pro-inflammatory, increases cortisol levels, renders the cells insulin resistance with the excess. High carb diets cause a lot of fluid retention, and that is very inflammatory on our mechanism. And again, high carb is high calorie, but no nutrient benefit. So Mediterranean is there, also promoting very good vegetation, very good meats, very low carbohydrate. They are not necessarily no grain, but they are low grain. Veganism winds up being a choice that may be philosophical, but we need to keep in mind that to promote a lot of the protein ingestion for a vegan diet may require a lot of beans. And now we have this section of beans to consider, that if eaten just regularly cooked or raw, has a big lectin surface that hasn't broken down. And lectins can also be quite hard on the gut to digest. So there are ways to sprout your beans that will have a less lectin effect, or high pressure cook them. So there are ways to work around some of these issues, even if a food on first glance is high inflammatory. Again, I just need to remind you all that medications are at the tail end of the process when the body is sick. But at the core foundation of most functional medicine conditions and prevention is the diet. The diet needs to be at the core of our foundational makeup, and all medicines in the world won't work if you are feeding yourself poisons. Okay, hopefully this shed a little light on low inflammatory diet eating. I'm Natalie Kunzman, MD. Subscribe to my channel below, and until we meet again, be well.